Hello, and welcome to Timing is Everything, a program of Care Dimensions. My name is Mary Crowe, Director of Professional and Community Education at Care Dimensions. We continue with our series of programs for you around hospice, a journey of care, through the lens of the interdisciplinary hospice team. Today our topic is Navigating Grief, the role of the bereavement counselor. We have the pleasure of speaking with Patrice De Pasquale, Director of Bereavement and Pediatric Palliative Care, and Sarah Bujold, Child Life Specialist. Patrice and Sarah, welcome to the show. So happy to have you here today.
Thank you for having us here, Mary.
So, you bet.
Great
So
to be here.
we're going to start out, and Patrice, I'll start with you, but why don't you tell the audience a bit about yourself?
Thanks, Mary. I'm Patrice De Pasquale. I'm a licensed clinical social worker. I've been a social worker for about 25 years, which is hard to believe, and have been at Care Dimensions about 9 years. I really enjoy supervising our bereavement team, and I also provide oversight to our pediatric palliative care, which is a Department of Health contract that we have.
That's excellent. Thank you. Sarah, how about you?
So I am a certified child life specialist, and I have been with Care Dimensions now for a little over 8 years. I originally started off as an intern, and I currently work part-time, covering mostly the greater Boston area and supporting children, teens, and their families of adult patients, as well as some of our pediatric population.
Thank you. Yeah, and that's going to be important, and we'll talk about that during our time together, is that, you know, sometimes people think of hospice care and they're thinking it's just for people who are older with serious illness, but death is not a respecter of age, is it? And certainly children are an important part of this as well.
Absolutely.
So we'll get to talk about that. I want to start with, tell us, you know, what brought you to hospice care? What makes this work so special? Go ahead, Patrice, you can start.
Thanks, Mary. I started my social work career working mostly in long-term care, working with older adults and adult day health, community programs, as well as hospital settings. And of course, over the course of that time, end-of-life issues came up in all of those settings. I worked very closely with caregivers as well as folks who were really navigating long-term complex illnesses, and that ultimately brought me to hospice.
Nice, yeah. I definitely feel like this is it's a calling. You know, it's something that's that people are drawn to. That's nice. Thank you. Go ahead, Sarah. How about you?
So when I originally started off as an intern, I was a little hesitant to work in hospice. A traditional role for child life specialist is working in pediatric hospital settings. And I just think too, the topic of death and dying is not something we commonly talk about. And then coupled with children and teens, I just really felt the weight of that and the seriousness of it. But I think what really drew me in and what makes it so special is that we really are able to meet the families where they're at, whether it's over the phone or in person. We're really getting to know what's important to them and what their wishes are, and we can adapt our interventions and support them that way. And it gives us that ability to slow down and get to know the family.
And here you are 8 years later, right?
Yeah.
So regardless of the hesitancy, which is so common and not unusual, right? That again, this has it has kept you here.
Totally.
Which is wonderful.
Yes.
Oh, that's great.
Yeah.
So let's start too with talking about how do you help families cope? You know, like how well. I want to start with the assessment actually. How do you assess needs of grieving families and provide them with individualized support? Because again, this is not a cookie cutter. This is something that we need to really personalize, isn't it? So why don't you start, Patrice?
Absolutely. So we have bereavement counselors who are licensed clinicians, mental health counselors, licensed social workers, and we collaborate with the hospice core team who's in the community in the home settings as well as at the hospice houses. You know, we talk with them about how the families are coping, and they do have a referral process where they send folks, information to us, and we really kind of review and personalize, what is needed for each family. So in meeting, really setting up a session, a counseling session, and at that first meeting, our counselors will just really review, how they're coping, what the journey was for their patient, and make a plan of care at that point. Sometimes it's short-term counseling, sometimes folks maybe do a few counseling sessions and then maybe are interested in a support group.
Yeah.
Not everybody is looking for the individual support.
Yeah.
So there's a whole variety of things under our program. We have services of remembrance. Sometimes people just prefer to attend something like that and be together and grieve as a community.
Sure.
So, you know, we just really like to explain all the different options under the umbrella of support that we offer.
But very individualized, right? Because again, you know, there's these misconceptions of that there's a right and a wrong way to grieve, this is how we do it, all of that. All misconceptions, aren't they? Such a personal thing.
Absolutely, and there's no time frame either, and I think that's something, you know, we are here, you know, after their loved one passes, but sometimes people don't reach back out to us for a few months. They might have to kind of get through those early stages of grief on their own, and then they contact us and they're looking for support. So it really does vary. So we remind people that they can contact us anytime.
Yeah, sometimes it takes time for everything to kind of kick in too, with the shock factor and everything else that people are coping with early on.
Exactly, exactly.
Yeah.
It's important to, like you said, everybody deals with their emotions differently. Some people are more private, and some people, you know, really express it more outwardly.
Yeah.
And so we try to normalize that for people when they come in and meet with us.
Yeah.
Sometimes within one family, different people are grieving differently, and sometimes that's how family conflict can happen, because
Sure.
people's feelings get hurt if they think someone's judging them, or they think you know, someone else in the family isn't quite understanding their level of pain.
Sure.
So just kind of validating those experiences is a big part of the work we do.
Absolutely. How about Sarah? Let's talk about kids for a minute, because it's different.
Yeah. So when we're coming up with a plan for children and teens, a lot of times we're receiving referrals from staff. So they've kind of already introduced our role a little bit to the family, and received confirmation from that family that they want to receive a phone call from Child Life. And really that's when our assessment begins, talking to the parents and caregivers and just kind of determining what their individual needs are. You know, how are they coping? What are some of their coping skills? You know, where are they at developmentally? What is their support system like? And so asking a lot of these questions gives us an idea of, you know, and we're coming up with these plans with the family as well, you know, if they should be receiving, or if they would benefit from anticipatory grief support or grief support. Or maybe it's more of just resource sharing, giving them our children's packet or providing them with developmentally appropriate books to read to their children. It might be giving them information on language, explaining everything that's going on. For younger children, it can be harder for them to understand that death is permanent, so really giving them, the parents, the tools and the language to help their children understand everything that's going on.
That's a really important point, and so let's talk about that a little bit more, because you know, there's all these myths and misconceptions that we deal with every day, don't we, in hospice care, and I think it's so important that we demystify this for people. This is hard enough for people to go through, but when they feel like, again, there's a certain way that things are done, or that there's, I don't even use the word normal, because what is it, right? It's what usual ways and that sort of thing.
Yeah.
For children, you know, people think that children, they don't grieve, that this doesn't affect them. So we try to shield them from it. Talk about that some more.
Yeah, there's a quote that comes to mind, and it is, if you're old enough to love, you're old enough to grieve. And I think a lot of times, I often hear from parents and caregivers, you know, my child isn't talking about it, or they're not coming to me and asking me questions. And a lot of time I think, you know, parents and caregivers are really wanting to shield and protect their children and teens from all of the heavy, challenging things that are going on. But unfortunately, children do pick up on the energy of their parents and caregivers. They overhear bits and pieces of information that's talked about when, you know, they think that, you know, the parents believe that their children aren't listening. And so I think it's important for parents and caregivers to check in with their children, you know, how are you doing? And really kind of getting an idea, asking open-ended questions of what they want to know, or what they already know, or what they've heard.
Sure. And also, I mean, because again, a lot of times children are not, they're going to work through their grief differently, whether it be through play, through arts and, you know, creative ways, arts, that sort of thing. It's different. It's different from how adults do it, right?
Yeah.
And there's also some telltale signs too that might come up for parents to be aware of as well, right? And maybe you could talk about some of those, you know, whether it be behavioral changes, that sort of thing.
Yeah, so children a lot of times will process their grief and their experiences through play.
Yeah.
And so some parents and caregivers will hear them mention that their child is talking about, you know, the loss or, you know, the medical condition through their play, and they wonder, you know, is this okay? But it is okay. That's their way of processing what is going on. I had a little boy, he drew a picture of, you know, everyone that was at a funeral with him. He had attended a funeral, and then the next day drew a picture of everyone that was there and the body in the casket, and that was really his way of kind of processing everything that was going on.
Yeah. Absolutely. And I think it's important too to look for other signs, whether you know, children might have other behaviors, maybe bedwetting, other things that, you know, that sometimes we're not even aware of, and we think not even associating that with the grief.
Yeah. So families might see, you know, some regression, some difficulty sleeping at night, concentrating. I definitely find that children will mention that they're so distracted throughout the day with school and extracurricular activities and homework that by the time they get home, that's like their one time to really process everything. And then of course that's around bedtime, so then it kind of trickles into that period in time where they might be experiencing nightmares. They might have a tough time falling asleep. And so we really do try to work with families and children and help them find ways to process what they've been going throughout the day, whether it's checking in with a social worker at school, taking 5 minutes to journal. You know, all of those can go a long way.
Absolutely.
And if I could jump in here too, one thing when we're working with parents, you know, on the adult side, is really to just help them understand too that they can model for their children, that it's okay to grieve, and you know, even just having things like, you know, celebrating a loved one's, you know, birthday together as a family, whether it be creating a little memory garden, you know, in the summertime for their family, and you know, get the kids involved in that, and just you know, that it's okay. Sometimes, you know, the kids are maybe afraid that they're going to, you know, upset their parents and caregivers and make them emotional, when really if they could have some nice conversations as a family, if you know, maybe the parents open up the door to that, right?
Totally.
Such a tricky thing though, isn't it, where the parent is grieving too, and and you're having to tend to the grief of others around you. It's really, it's complicated, and that's why again it's so important to know that there's support around, isn't there?
Absolutely.
Absolutely.
Let's talk a little bit about anticipatory grief, you know, and how, you know, I think of this with people who have a loved one who might have a long caregiving experience, a long drawn out illness, that sort of thing. How can you be of support in that way? Either of you jump in.
So one thing that we do offer at Care Dimensions is a caregiver support group. I actually facilitate that group on a monthly basis, and that is something that anybody in the community can attend. As well as our hospice team does refer families to that group, and you know, it's really a great space for families to, caregivers come together, just talk about you know, what they're coping with, how they're trying to, you know, a lot of times people really, they struggle with trying to be strong for their person who's sick, but they have their own emotions, and so I always say they get like an adrenaline rush that kind of has to, like, you know, give them energy to push through, when really, you know, they need to do some self-care so that they don't collapse, honestly, you know.
Absolutely.
And so try to encourage a balance. You know, that's one thing that we talk about in that group, is really important.
When is that group, so that people
It's typically the second Monday of the month.
Nice.
10:30 in the morning. It's held virtually, so it's open to anyone. It's free of charge.
That's great.
Yeah.
Those, again, as many resources, right, as that we can offer out and make people aware of. That's wonderful.
Absolutely.
And again, in terms of anticipatory grief for children, what are you thinking of, Sarah?
Yeah, so we do offer 2 sessions for pre-bereavement support, and we can meet with children and teens either at the Danvers office, the Lincoln House, or virtually.
Yep.
And really, when we're meeting with them, we're just providing them that space to kind of talk about or not talk about, you know, everything that's been going on. For our pediatric population, we meet with them more often. We have a little bit more flexibility. And when we're working with them, you know, it really is kind of whatever the family wants, but we do a lot of memory making and legacy building. We offer a lot of sibling support as well, and really helping them, you know, identify and learn how to talk about, you know, their thoughts and feelings, and giving them that space to process.
Yeah, that's great.
Yeah.
It's so important. The feelings have to go somewhere. They, you know, they've got to have that outlet, and a lot of times people feel like they have to. It's the feelings are so strong and uncomfortable a lot of times that people try to push them down, and you know, we want to encourage just the opposite, don't we?
Right, right, totally.
How about, you know, when people, when after the death, after a person has died, how do you support people then? What kind of services, resources do you provide? And how to just help people with that journey, with that process?
So our department is essentially also offers information and referral as well. So anyone in the community can call us, or we have a dedicated email, grief@caredimensions.org. And so we do have a lot of folks that, you know, are looking just for something specific. So we do a lot of resource sharing. We have tip sheets. We have a grief page on our website that has a lot of book lists and a lot of other resources that we can share. So, you know, besides our support groups, we have a monthly calendar actually that's posted every month on our website. People can register directly there, or they can call us and we can help them do that over the phone. All of our support groups we're very blessed that we have generous donors who, over time, foundations and grants as well, that help support our programming. So we have multiple different types of groups. We have loss-specific groups, such as loss of spouse partner, young widowed. Every month we have a newly bereaved workshop, and that's something too. A lot of physicians' offices give that information out to families too, so it is an important resource for people to know about. That's a 2-hour sort of psychoeducational group where they really talk about coping tips for the early stages of grief.
When you're considering people newly bereaved, what time frame should they be thinking of with that?
That's a good question. So essentially, like, we recommend that group is really good for people within the first couple of months after the loss, maybe somewhere between a few weeks up to three months or so, because they do talk about sort of the intensity of the stages of grief and how early on there's a lot of shock and sometimes denial and you know, just strong emotions.
Sure.
And just, you know, some tips on how to kind of navigate through that.
I also wanted to go back to also, Patrice, you had talked about just how specific the groups are. It's so important because a lot of times people think, oh, it's just like one big support group. Talk about why it's so important to be so specific in terms of the grief support.
Thank you. I think that's one thing that makes our program really unique, is that we do offer these very loss-specific 8-week session groups. So, you know, we have a loss of spouse partner group where they meet for eight consecutive weeks, and so a lot of times people just, after losing the person they've been with for decades, right, they really, you know, just grapple with isolation, loneliness. And so coming to these groups and really being with other people, it's amazing to me when I facilitate these. Just people can come from so many different backgrounds, but they come together and they bond so quickly because they've been through, you know, very similar experiences. So it's very real, very honest. And so we cover different topics. We have readings. We even share photos and things like that over the course of the time to honor the person that they lost. And so a lot of times folks will actually continue that group. They tell us when the sessions end, they start to meet up for coffee once a month. So they become lifelong friends. So that is amazing for us as a team to see. But we also have loss of parent groups. Raising Grieving Children is another one. Actually, the Child Life team has been part of over the years as well. So just the commonality of the relationship actually
Yeah.
is why we break them down by
Yeah.
different type of groups.
Yeah, it's so important because, like I said, you know, if you're grieving the loss of a parent versus loss of a child, they're just such you know, different losses.
Yes.
And so it's so important to kind of bring that, even when you do separate it like that, people's loss is still so personal and individualized.
Yes.
But then you're bringing in those similarities, and that, you know, that they can being feeling like they can have that more shared.
I think it just increases the way people connect and bond with each
Yeah.
other,
Yes.
and that they really they really understand
Yeah.
each other.
Yeah. I also love about support groups is that people, because they can be at different points in that, and how you can really kind of acquire more tools for your tool belt, you know, about what has worked for other people, and people kind of, you know, I love that sharing too of resources in that way.
Yeah, it's really amazing to see. I think that it's, again, it's just sort of the honesty that people can say things in those groups. And we always say it stays in the room.
Yes.
And we ask people to respect each other's confidentiality, but they say things that they may not even say to their own family members, you
Yes.
know.
Yeah.
So it's pretty powerful.
That's wonderful. Sarah, how about for the children?
So for bereavement support, a lot of times we've been connected with the families already. So we usually are notified by staff after a loss, and then at that point we'll reach out to the families and offer a condolence call and just check in. And then from there we kind of decide, you know, what the family is really looking for. Some families are really interested in some of our resources. They might have questions along the lines of, you know, should my child attend a funeral or a memorial service? You know, how do I explain cremation? So we have tip sheets that talk about that. We also offer individual grief support. We offer up to 4 sessions free of charge. And again, we can meet with children and teens either at the Danvers office, the Lincoln House, or virtually. We offer Camp Stepping Stones every year. We have children's program events and support groups.
Yeah.
So those are available.
So, and it probably varies, but, you know, because people will ask that question about, like, how, you know, at what age should my child attend? It's not really the age itself necessarily, right? It has to do with developmental age. And there's so many factors that come in there, because, you know, you might have a child who you think just because of the biological age that they could attend. So it's hard to say that if developmentally they're at a different point.
Right, yeah, and so we often encourage families to check in with their children and see, you know, if that child is interested in attending. And then at that point, you know, really breaking down, you know, preparing them for that experience. You know, what does it look like? You know what, you know, is there going to be an open casket or is it going to be closed? Like really just preparing them for that experience, as well as making sure that there's support in place in case they need it. Yeah.
You know, and this is bringing up kind of a thought for me, you know, just in terms of the Camp Stepping Stones. So maybe you could just talk about that, because when you were talking about this, I've had the good fortune over the years, because for over a decade I volunteered and had the 10 and 11 group, and when I watched these kids come together, all having various types of loss and the bonding that went on. So can you talk a little bit about Camp Stepping Stones for us?
Well, we're excited to say it's our 24th Camp Stepping Stones coming up this year. So,
Wow.
and that's quite a legacy.
Yeah.
We're very thrilled that Glen Urquhart campus in Beverly Farms allows us to use their beautiful space, and we really we have typically up to about, you know, between 40 and 50 campers over the years, along with their caregivers. So maybe Sarah can talk about the children's programming. I would like to say, though, we do offer programming for the parents as well, which makes it very unique compared to some other camps. You know, we do have you know, breakout sessions for parents and caregivers to help them with their coping. Things like even yoga for loss is offered. We'll do loss of child, because some of the families have lost a young child, and some of them have lost parents. And so we'll do, you know, kind of like a little mini loss of spouse partner group as well at that. And the children's programming is amazing. A lot of creative arts and expressive arts.
Yeah, children and teens rotate through expressive art activities, movement activities. We have music therapy that joins us every year. And it really is a nice day for families to come together and remember and honor their person. Yeah.
I've just watched them at the end of the day and just making lifelong friendships there as well, lifelong connections. So it's really wonderful.
It's amazing how resilient the children are. I think that's what always kind of gets me, you know, because we're always worried as we're talking about how do you talk to the kids, but they show us like how to respond, because they're just so intuitive. And they, at the end, we have this closing ceremony with the beautiful heart puzzle that Mary is very familiar with and assists us with. But some of the kiddos now will get up and grab the mic and sing a song about their person, or they'll tell a memory. And I think that most of us are standing there just in awe of them as they do this.
Absolutely.
So it's pretty special. We're always looking for volunteers too.
Excellent. Put that out there. So the time always goes so fast when we're talking about these topics. We just have a little bit of time left. So I just want to ask you before we wrap up, what's one thing, the one gem you want to leave with the audience today before we do that? I'm going to give you each an opportunity at that.
Well,
that we didn't get to talk about maybe, or one thing you want to leave with.
I think for me, it's just, you know, working with this amazing team who really find this work so meaningful. I have to say everybody in our program in bereavement, as well as at Care Dimensions that we collaborate with, their heart is in this work, and a lot of them have been through their own losses, as we all have in life. And so it kind of draws people to just really be compassionate and be present and just really, you know, support people in a very real and compassionate, honest way. So it's a privilege to do this work.
Thank you.
Yeah, I would agree. Yeah, I love how well everybody works together as a team, and I think with working with children and teens, I feel like I tell families all the time, don't ever hesitate to reach out and ask. There's no issue in asking a question or mentioning something that's unusual. If you have a concern, always ask.
How can people reach you?
Oh, well, that's a very good question. So we do have a dedicated line just for the bereavement team. So the phone number is 978-774-5100. If they call the general Care Dimensions number, there is actually a number they can press. I believe it's number 6 on that list. And they also will be connected that way. And we have an email, grief@caredimensions.org. So, and we have our admin team. We're all, and I'm on that as well. So we respond to people daily, looking for requests, looking to set up sessions, or for support groups, and to share resources.
Nice.
So, you know, we really try to be as responsive, knowing that people are really having a difficult time, and this is what we're here to do, is to support them through that.
Excellent. Well, thank you both so very much for being a part of the show today. I really appreciate you lending your time and your expertise on this, and this is really important information that you're sharing today. So thanks so much for being here.
Thanks for having us, Mary.
You're welcome.
Thank you. Appreciate you.
And thanks everybody for tuning in, and I look forward to you being a part of our other programs.
If there's one thing that I could tell people about hospice, it's that it's not just for those final days of life. I think oftentimes people wait until it's too late, and it's not as scary as it sounds.
Don't be afraid of hospice. We're not here to make life scary, and we're not here to tell you it's the end of life. We're here to help. And I honestly think that the more people that have hospice, the better, because you have so much support. And it's not just for the patient, it's for the family as well.
And again, that hospice isn't about dying. It's really about making the most of whatever time people have, and trying to bring them comfort, or create a space of comfort for them that sort of supports them both physically, emotionally, and spiritually.